tell me about heart failure. Does that mean the heart stops?
It doesn't stop, but that forward flow does not work as well, and there's some congestion. And congestion is back to the lungs. And that's the idea of being congested, fluid buildup, short of breath.
And when you get the buildup, well, how do you treat it? What do you do for heart failure?
So we can use a type of medication called diuretics, and diuretics stimulate urine output to get rid of excess fluid.
So it doesn't put as much load on the heart if you don't have as much fluid.
Right.
Anything to strengthen the heart muscle?
We do. We actually use the medication that I mentioned, beta blockers, and we use other types called ACE inhibitors and ARBs, and that improves the forward flow of blood flow out of the heart.
So the early symptoms of heart failure would be what?
So the early symptoms can be fatigue and exercise intolerance, where you have to stop, you can't do the types of activities that you normally do, shortness of breath. As it progresses, you have trouble lying down, and you may have fluid buildup, not only in your lungs, but in the rest of your body.
You get edema of the legs?
Yes.
How do you detect edema?
Well, we can do it by examination, so we can listen and examine the patient, and we have very good blood tests now that tell us that, called a BNP blood test.
And the BNP blood test can really tell you if you're in heart failure?
It's very helpful, yes.
And the medicines help control it, and you have to keep in contact with the doctor to be sure that the heart's functioning well.
Very close contact, yes.
Anything new in heart failure and heart rhythm problems?
Absolutely. So we have new medications that have been very helpful. I mentioned this ACE inhibitors and ARBs, and they're called ARNIs. So it's a new class of medication. They're even better. And we have new devices like defibrillators, pacemakers, defibrillators. And we have monitors that can be implanted to monitor pressure within the heart and the lungs.